Hello and welcome to Pharmacy Notes. In today's video, we will be discussing the top 10 must-know pharmacology terms for pharmacy students. As a pharmacy student, you will come across many of these terms throughout your education and career, and it is essential to understand them to become a successful pharmacist. So without wasting further time, let's get started with the list. On number 1, we have pharmacokinetics. When talking about pharmacokinetics, we are basically concerned with the 4 factors, that is absorption, distribution, metabolism and elimination. In pharmacokinetics, we study how a drug is absorbed, and after absorption how it is distributed in the body. Then we study how it is metabolized, and finally how it is eliminated from the body. So basically understanding the pharmacokinetics helps us in understanding how the drug works, and by this we can by studying pharmacokinetics we can also design the dose that is required. So it also helps in dosing correctly the medications that we need. On number 2, we have pharmacodynamics. Pharmacodynamics is study of effects of drugs on the body. That what effects does the drug on the body, we study it in the pharmacodynamics. So basically how a drug works in the body, the drug binds on the receptors and then it performs its function. All this we study in pharmacodynamics. So simply the effects of drugs in the body are studied in pharmacodynamics. On number 3, we have half-life. The half-life of a drug is the time it takes for half of a drug to be eliminated from the body. This is very important in dosing the medication. So by this we will know that how much a time a drug takes to be removed from the body, and by this it helps us in designing the next dose or determining the time when the next dose should be administered in the body. On number 4, we have therapeutic index. Therapeutic index is the ratio of a dose of a drug that produces a therapeutic effect to dose that produces a toxic effect. So drugs that have high therapeutic index are considered safe, and the drugs that have low therapeutic index are not that safe, so they require a continuous monitoring. The drugs that have low therapeutic index include phenytoin, digoxin, carbamazepine, etc. On number 5, we have side effects. Side effects are unintended, unwanted and undesired effects of drugs that can be produced in normal doses, and they can range from mild to severe. So before dispensing or prescribing medicine, we should be aware of the side effects that the medicines can produce, and we should convey that to the patients. So it is our responsibility to tell the patients that these can be the side effects of the drugs that are being given to them. On number 6, we have contraindications. Contraindications, there are certain conditions or situations where a drug should not be used, so it is said to be contraindicated in that condition. For example, there are many drugs that should not be used in pregnancy, so these drugs are considered contraindicated during the pregnancy. So it is very important for us to know that for which conditions the medicine should not be used before prescribing or dispensing. On number 7, we have drug interactions. Drug interactions can occur when 2 or more drugs interact with each other in the body, and this can result in unintended effects. So it is important to be aware of potential drug interactions while we are prescribing or dispensing the medications, and if there are any drug interactions, we should change the drugs so the patient's safety can be protected. On number 8, we have dosage forms. Dosage forms refer to different forms in which medications are even available. These can be tablets, capsules, liquids and injectables. So the understanding dosage form is essential for proper medication administration. On number 9, we have generic versus brand name. Generic medicines have the same active ingredient as the brand name medicines and work in the same way, but they may look different and may contain different non-active ingredients. Generic alternatives are often cheaper than the brand name medicines. On number 10, we have FDA approval. FDA approved drugs for use in United States, and they are not just approved like that. Before approving for use, they are tested and their quality is checked and their efficacy and safety data is analyzed. So all the drugs that are used, they are first approved by FDA, and after that they are used for treating the patients.